Hello, today we are discussing about post-term pregnancy or prolonged pregnancy. Um, this is traditionally defined as pregnancy that has taken more than 42 weeks of gestation. But this should be for a well-documented pregnancy because a number of pregnancies is classified as post-term or prolonged when they are actually not. So it's important to look that. Um, and then um, we will look at the risk factors, management, and complication of prolonged pregnancy in this lecture. What goes about post-term pregnancy? It's not very clear what exactly brings about post-term pregnancy. But there are a number of risk factors that can actually be attributed to post-term pregnancy. Nulliparity, if someone has never had a pregnancy, before that was her first pregnancy, you're more likely going to have a cervix that takes longer to ripen, and that may actually prolong the duration of pregnancy. If a mother is above the age of 40, it is seen that these mothers have a higher risk of developing going into postpartum. If a mother has previous prolonged pregnancy, they are also at a higher risk of getting that. So probably it's attributing to genetic. If you had a prolonged pregnancy, you're more likely to going to have a prolonged pregnancy. If you're born as prolonged pregnancy, you're more likely to have that. Then mothers who have high body mass index, and then history of prolonged pregnancy, as I said, could be genetic. This is something that you need to remember when you're looking at a pregnancy, and this will also guide you when you are considering delivering a mother. Between 37 weeks to 40, you realize that the neonatal complication, the rate of stillbirth is 1 in 1,000. And this rises to 3 in 1,000 when the pregnancy reaches 42 weeks. And this is even double within just 1 week. So normally you need to be very careful when you're looking at a postpartum mother because of risk of stillbirth that may occur. And this is because of placental insufficiency. As the pregnancy goes beyond the term period, the placenta start aging and this become insufficient, and this will lead to neonatal hypoglycemia and resultant death of the baby. And also it might actually cause problems at the time of delivery. So it's important that you need to look at that. The clinical features of postpartum pregnancies is not very clear how they actually present. Most of the time we look at the stigmata of postdatism that is seen on the baby, and that is seen late in the baby. Of course, the most common features that are present could be static growth of potentially macrosomy. There may be static growth. That means that the baby will stop growing, or there may be actually, sometimes the placenta behave in an unusual way and the baby is actually okay, become macrosomic. Because of placental insufficiency, there is likely to develop oligohydramnios, and then you also have reduced fetal movements that occurs, and there may be presence of meconium while you're actually having that. And then you have signs of long nails. Actually, this is normally what happens. The babies are born when they are too old. The nails are very long, with the long nails. And then the skin, because of the vernix are lost, and then the amniotic fluids actually start causing the skin to become dry, flaky, will reduce vernix. So that's what normally brings about that wrinkles on the skin of a baby born as a postterm. You see this vernix that is seen on the baby's body, and this protects the skin from the action of the salty action of the amniotic fluids that actually cause wrinkles on the skin. Look at this. They actually appear bigger, and then they have very reduced fat content in the body. That's a result of postterm pregnancy. What are the differential diagnoses of postterm pregnancy? It could actually be a wrong date. Because of a wrong date, you may likely to have that. So it's important to do an ultrasound scan between 11 and 13 weeks. And 13 weeks. 13 completed weeks. So it's very important to do scan between that time, and that's the most accurate scan that can be used for dating. So in your practice, when you start practicing, please consider mothers to do scan around that time. And that scan is actually what they call the dating scan, where we use the CRL, the crown ramp length. So you may need to consider that. What investigation do you need to do? Of course, scan is very important. You need to look at a number of factors, the non-stress test and whatnot and whatnot. How do you manage a postterm pregnancy? The guideline is very clear here that 41 weeks gestation, you may actually need to consider doing an induction. So when the baby has gone beyond 41 weeks, you may actually need to achieve doing induction. Do membrane sweep around 39 weeks. This will actually increase the risk, the chance of having birth as early as possible. So at 41 weeks, please consider induction and then do that. Of course, it will be good to do a very good monitoring of the cardiac activity of the baby using CTG. So you maybe look at that. You can also use an ultrasound scan to look at the amniotic fluid and measurements just to look at the risk that may be there, and maybe the size of the baby or something like that. So basically, this is about postterm pregnancy, and you may need to read more about it, and then when we come, we'll discuss more if you have questions, queries, or you have any concern. Thank you.